So welcome everyone and good evening. Welcome to the Assembly of Osteopathic Graduate Medical Educators AOGME webinar series. We are pleased to have you join us for this academic career pathway / clinical education leaders series webinar on best practices for publishing and medical education journals. My name is Dr. Katina Rue, and I'm the chair of the AOGME Education Committee, and I'm going to help facilitate this webinar. Before we get started, I'd like to review a few housekeeping notes. The webinar is being recorded and the recordings will be available on the AOGME webpage within the next 7 days. The webinar participants should all be in listen-only mode. And if you have any technical difficulties during the webinar, please write to us in the chat and we will assist you. If you have any questions for the presenters during this webinar, feel free to submit them through the Q&A feature at the bottom of your screen or in the chat. We will be monitoring that. And hopefully we'll have a little bit of time at the end to answer any questions. And I'm also excited to announce that osteopathic physicians can earn up to 1 AOA Category 1A CME credit for attending this webinar live. So to obtain your AOA CME credit, you must complete the post-webinar evaluation and email aogme@acom.org, and we will send you the attestation form. And without further ado, I will briefly introduce our presenters. Dr. Mark Spiker, PhD, MHA, is the Senior Vice President of Research, Learning, and Innovation at ACOM. Welcome. And we've got Gev, MS, the Director of Data Science at ACOM. And Tony, MA, is the Director of Medical Education, Digital Strategy, and Engagement at the AAMC. Thank you so much to our presenters for joining us today and sharing your expertise. I'm looking forward to a lively webinar. And with that, I'll turn it over to you. Thanks.
Hi, everyone. I'm excited to be here to talk about publishing and academic writing. I'm Tony Gallo. I work at the AAMC, but I have a long background history with the journal Academic Medicine. And so that's kind of the perspective that I'm coming here today to talk about, specifically thinking about medical education publishing. And I wanted to start with what do you, when you're thinking about I'm submitting, the editors are going to be looking at my work, what kind of things are they looking for when I submit my paper? And so what's really important is having a clear rationale for your work and stating that upfront in your paper. So don't let the editors have to guess why you're doing this work or what the purpose of it is. State it upfront in your paper. They're also going to look for novel, interesting ideas that are a good fit for their journal specifically. So this is why it's important to kind of understand what the mission and scope of each journal is and how your work fits in with that journal. The editors are also going to look for the organization of your paper. Is your argument well constructed? Does your paper make sense? Can they follow it from the beginning to the end? And then they're really going to pay attention to, how polished is your work? Again, does it make sense? Does it flow well? Even down to, are there typos and is the writing really clunky, or is it very obvious that different people have written different sections of a paper? We know that oftentimes multiple authors will work on something, but it's really important to, before you send it in, to kind of read through the whole thing and make sure that what you're submitting is really a cohesive, a whole paper and not just something that's kind of been pieced together. Some other things to think about as you are developing your paper, really come back to that rationale and the reason that you're doing this. What's the purpose of this paper? What message are you trying to get out there? What do you think this paper is going to contribute? How is it going to add to the literature? And have you told the editors and readers that? Have you put your work into the context of what's out there? Think about too how all of that fits in with the different journals that are out there. Each journal has a unique audience and mission and scope. And so, the people you want to read your paper, what journals are they reading? And that's a good way to think about where your paper might fit, is think about the audience of a journal. And if those are the people you want to read your paper, are they the ones who are working on the same areas, thinking about the same topics? Also think about when you're, deciding on a journal or kind of how to frame your work. There are so many different article types that are out there. Different journals have different article types. There is not one article type that's better than all the others. Each one serves a unique purpose. But familiarize yourself with those article types, the kinds of things that people publish in each of those, what journal has what article type, because that's going to be important to sort of fitting your paper and finding the right home for it. And then, familiarizing yourself with the instructions for authors for each journal. Every journal is going to have information, down to like, what are the headings that you need in your paper for that journal? What's the word count? How many tables or figures or things like that can you have? So it's important to read the instructions for authors and make sure that you're following those when you're submitting to different journals. As you're developing your paper, really think of it as telling a story. Even if you're reporting research, you are sharing a story with your readers. And so that should start the very beginning of your paper, as you're introducing the topic, as you're kind of setting the stage, setting the context for how your work fits into the larger literature on that topic. Where is the gap there? How does your work kind of fill that gap? And that should carry through to the end of your paper. This is a last page that has some specific instructions for or guidelines for how to do that if you're reporting research. But this can sort of, thinking about this story and what's the story you want to tell, what's the purpose of your paper, can help you figure out what's the right journal and what's the right article type for your work. And oftentimes, being able to present your work in the right form to really emphasize what you want to emphasize is helpful for the editors to truly understand the impact of what you've done. So an example would be maybe you've developed a program, and if you want the emphasis of your paper, like what you really want to tell readers is about the development of that program. So who did what, how it came about, what are the components of the program? Something like that would be a program description or an innovation, a description of an innovation, because that's really what you want to emphasize. I think sometimes we get stuck in the like, well, I have to report research and I have to sort of fit my work into a research report because, that's the most important kind of scholarship. But that won't serve, if what you really want to do is describe your program, that won't really serve your message very well. Maybe the focus is data analysis and it is evaluation, and you want to dig into what do all of those assessments actually mean. That might be a research report, but you can see how sort of depending on what the emphasis or the focus, there are different article types that are going to let you highlight the best parts of your work. So really think about, what is that message? What is that story that you want to tell? And how can you best do that for readers? Sometimes I think it's a bit of a mystery, like you submit your paper and then what happens to it. It seems to go through this whole process at the journal, but this is kind of an overview of what that looks like. This is a generic version of the review process that most journals follow this pretty closely. There are slight differences at different journals, but this is sort of the overview of what the process looks like. And I want to walk you through it so you can kind of see what's happening at which stage. And so the corresponding author will submit the paper to a journal, and the journal editors will look at it and they'll do kind of an initial review. And at that stage, what they're really looking for is, does this paper fit with our scope and mission? You know, have you submitted a clinical paper to a medical education journal that's just, not the right place for it? And if that's the case, papers will get rejected. It's usually called like a desk reject. And the editors will say, this is not for us. The authors can then decide, do we want to submit it somewhere else? And they'll kind of start that process over. If the editors decide, yes, this is a paper we're interested in, they're going to send it to peer review, and they're going to get those external experts to look at it and submit their feedback and their recommendations. And then the editors are going to look at it again, and they're going to decide at that point, is this something that we're not interested in? They might reject a paper. I will say it is incredibly rare for something to get accepted at this point. I think pretty much everything is going to go through at least one round of revisions, but a paper could be accepted initially. And if they decide that they want to ask for revisions, they're going to send you usually comments from the editors, the comments from the reviewers, and they're going to ask you to revise. Sometimes it might be really overwhelming. You get like pages and pages of comments from reviewers, and you're like, do they really want my paper? Like, look at all this feedback that they gave me. And I will say, if you get asked for revisions, that means that the journal really does value your work. They think that it has merit and they want you to keep going in the process. If they are not interested in your paper, they are going to reject it. So please don't be discouraged when you get all of that feedback from the editors and reviewers. They want to see what you can do with your paper. The other thing that I think is helpful, sometimes you'll get feedback and you'll be like, oh, that reviewer just like didn't get my paper. They like misunderstood what I was trying to say. Their comments maybe don't seem helpful, or you're like, that would be not fit with what I'm trying to do. And in those cases, I think it's helpful to think about like, where did the misunderstanding come from? And maybe that specific bit of feedback isn't relevant to your paper, but you can you can revise so that the next reader isn't going to have the same misunderstanding. Maybe there's language you can clarify or information you can add, but really think about like, what caused this confusion, and can I improve my paper for the next time so that somebody else doesn't have the same problem later on? You do all that, you resubmit it, the editors are going to look at your paper again. At this point, they could accept it, they could ask for additional revisions, they can also reject a paper if the authors haven't done what the reviewers have asked, if new issues have come up in the process. I think today it's pretty typical for most papers to go through, and this is across medical education journals, like 2 to 3 rounds of revisions. So don't be surprised if you're asked a few times to revise. That's kind of standard, I think, now. Once your paper is finally accepted, it's going to go into editing and production. Each journal, this looks a little different in terms of the kind of editing that they do. Some do a copy edit, some do a more substantive edit, but your paper, you'll work with the editors on that, and then your paper will move into production where it will get laid out and it'll look nice and pretty. The corresponding author will look at that page proof to just make sure everything looks okay, and then your paper will get published online. And at that point, it's published, people can find it, it'll be in PubMed, you can cite it, you can share it. So that's really the most important like publication point. If after that, then it can get pulled into an issue or get, included in a print issue, but that online publication is the most important part. So that's a little bit about the review and production process. I know AI is probably front of mind for everybody these days, and so I wanted to talk a little bit about some ethical, responsible ways to use AI in your writing and scholarship. Think of it really as a tool, so you shouldn't, I think we all know, rely on AI to write your whole paper, but it can help you with things like summarizing it, coming up with a title, if there are specific grammatical features where you're like, I always write in passive voice, I need some help figuring out where that is and how to write an active voice instead. AI is a great tool for all of those things. There's also some websites out there that help you figure out, like you put in your abstract and title, and it will suggest some journals that match topically with what you're writing on. And so those are great ways to leverage AI in your scholarship. There are a few caveats. First is, if you're using an open tool, like if you're just going to ChatGPT, be careful what you share with it, because you are putting your scholarship out there, into one of these tools, and that's not private or closed. So just be careful of that. A lot of universities now, though, are creating their own closed system. So you might be using this, with patient data or student data or something like that. And that's probably a safer place to put your scholarship. So that's an option if that's something your university offers. I think we all know that the types of things that you ask, the way you prompt AI is going to be really important in the output that you get. So it's, think about how specific can I be? How much information can I give the tool so that I'll really get the best answer that I can get? Always check what you get out of AI. I think it's doing much better in terms of just like making stuff up, but that still is a possibility, so be careful about that. And really think about AI as like a first draft. This is not what you're going to copy and paste and put in your paper, but it's meant to sort of help you get started. If you do use AI at any point in your research or scholarship or writing, you should always disclose that to the journal. So put the name of the tool, the version, and the date that you accessed it, and tell the journal that. Each journal is going to have a slightly different process. So some are going to ask you on the submission form, some are going to tell you to put it in the disclosures or in the method section if you used it for like your data analysis. So just know what the journal is going to, what their policy is and how they're going to ask you to disclose that, but always make sure that you're upfront and you're telling the journal that. And then the final thing I will say is that AI cannot be an author on your paper. It does not qualify for authorship. It cannot take responsibility for its own work. And so even if, you've used it as part of your research, AI cannot be listed as an author. And I want to finish up with a couple of resources that are helpful, additional resources you can think about. This is a curated collection that's on the AAMC's website, but it's got resources from all over. And it's meant to be, there's so much out there. So a kind of curated list for getting started, for writing up your work, for tips for publishing, some interviews with authors and reviewers to kind of see how they approach the process. So if you're looking for some resources at kind of any stage, this is a good place to just start and see what's out there without it being totally overwhelming. And then this webinar is coming up in a couple weeks. So if you are looking for like, how do I fit writing into my busy schedule? We're going to have a panel of authors talk about that. And it's going to be, like very concretely, do you block off your calendar and write for multiple hours at a time? Do you fit it in 15-minute chunks? Do you have a writing buddy? We're going to have authors who are kind of at different stages of their careers talk about how they actually get their scholarship out. And so feel free to sign up for that if you're interested. And then the last thing I'll say is stay engaged with all of your favorite journals. It's a great way to both kind of see what's out there, see what journals are publishing, what's happening in the literature, and also just getting a feel for each journal and what they publish and, might your work fit in there? So social media, most journals are on, they're on different social media platforms. So try to find your favorite journals there, sign up for their newsletters or electronic tables of contents. That'll help you see what's coming out and you can stay up to date. And then some journals have podcasts or video channels, and that's another way to see what's happening and kind of go beyond the pages of the journal. So I'm happy to answer questions about all of this. We're going to have some time at the end, so feel free to put your questions in the Q&A, but I will turn it over to Mark.
Thanks, Tony. That was great. I have even a couple comments about that I'll make during my presentation as well. I wanted to focus on the research question. One of the things that I often encounter when I'm working with students on their research projects, or when I'm working with junior faculty, is they'll tell me what they're interested in researching, and it's sort of a word salad, right? And it can be very frustrating when a question is too big or too ill-defined, and that student or that junior faculty member is going to have an unhappy start to their research experience just because their research question was really sort of not answerable. And so I wanted to focus on the research question today because I think publishable research starts with a good question. And so that's what I'd like to communicate to you today. And I want to really thank Tony for that great overview. We're going to talk a little bit more about AI, but reading journals is or listening to journals or listening to podcasts about journals is the best way to get ready to write a paper. It teaches you to think about the research questions that other authors are asking and how they're answering those questions. So some of the podcasts, I listen to the academic medicine podcast. It's very focused on stories, as Tony showed that academic medicine back cover by Lorelei Lingard and Chris Watling, and anything Lorelei Lingard writes, I try and memorize because she's a great medical education writer, and so that's, in my opinion, that's one of the focuses of the medical education podcast, or of the academic medicine podcast, I should say. There's another one called the Papers Podcast that sadly just ended, but there's a ton of archives if you go to the Papers Podcast. There's a lot of archives, and there's a lot on reviews, which we'll talk a lot about during my presentation. And then Keyline Plus is by the Royal College of Physicians and Surgeons in Canada. Those are the three I listen to every week or whenever they come out. Because I'm a podcast guy. I walk the dog in the morning, I listen to podcasts. That's sort of how it goes. But there's definitely other ways of keeping up with your journal, especially electronic tables of contents. I'm a huge fan, but I generally keep up through podcasts. Having a good question that includes a novel idea means that it's much more likely that your paper is going to get accepted, your paper is going to have greater impact, and it's going to advance the knowledge in our field of medical education or osteopathic medical education. In addition, for you as a faculty member or for your students, it demonstrates critical thinking, that they know how to, that you know how to, that the student knows how to approach a problem with original and critical thought. And I think you should encourage that of your students, of your junior faculty, and honestly, of yourself. I'm going to go over 4 kinds of sources of research ideas today. Keep in mind that there are 2 other kinds of publications that Tony mentioned that I wanted to reiterate that I'm not going to go over. One is an evidence-based opinion piece at academic medicine. Those are called scholarly perspectives. And so you can write your student can write up something that they are passionate about, informed by the evidence, to help educate all of us about how to take a critical look at an issue in medical education or in your specialty. The other one that I wanted to mention is clinical research. Many students want to be involved in clinical research. Clinical research is not my area of specialty, which is why I'm not talking about it, although I have served as the consulting biostatistician on many clinical research projects. And I can tell you that I'm going to be replaced in that role by ChatGPT. And I'm okay with that. But clinical research requires data collection. In the areas that I'm going to talk about, the data already exists. Your student or you or your junior faculty member that you're mentoring doesn't have to worry about doing good data collection. They have to worry about doing good critical analysis and doing good writing. And it's easier the fewer things you have to worry about, right? And so that's why I'm focusing on these four things. So the areas that I'm going to discuss with you deal with either unmet clinical needs or inconsistent clinical practices, policy changes, educational gaps, or emerging trends. And the four kinds of research that I specifically want to talk about are quality improvement research, physician workforce research or healthcare workforce research, doesn't have to be physicians, education research, specifically medical education research, but general education research is also an area for publication. And then reviews, literature reviews. In all of these areas, the data has already been collected, right? So in a quality improvement study, you're using historical patient data that you get from an electronic health record. And there's most hospitals have a well-established process for getting that data. IRBs have a well-established and well-known process for reviewing QI requests. And so there's not a lot of those parts, the data collection part of the show will not be a challenge for you or for your mentee. Workforce research, where do physicians practice? What do they practice? In what ways is healthcare access made easier or harder through the presence or absence of physicians or other healthcare providers? Those are the questions that are answered by health workforce research. Education research, so what practices in curricular design, in course design, in teaching, in assessing are useful in improving our students' learning. And then finally, literature reviews. There's several kinds of reviews that you can work on, each to answer a different type of question. But the data for a literature review, and it is data, comes from electronic libraries like PubMed. So for all four of these types of research, the data already exists, and that takes a big step out of the research. So let's talk about good research questions, shall we? As I said, that's one of the biggest issues, I think, in having a successful and publishable research project. So your question should be focused and specific, and this is often an issue that I encounter with medical students, and I enjoy helping them specify their question a little bit better. So for example, how can healthcare be improved versus how does access to ophthalmology improve patient outcomes in rural areas? One of those questions has an answer. The other has an ongoing volume of encyclopedic knowledge that will last until the end of time, right? How to improve healthcare. And you don't want to work as an author on an endless volume of encyclopedic knowledge. It's very frustrating, especially when you're trying to get published. So it should be clear and unambiguous. Everyone should agree on what the question means. It should be researchable and feasible. So if your student is doing a summer research project, it should take a summer. It shouldn't take the rest of their career, right? Or at least they should get a really good start on it over that summer. It should not yet be answered in the population that you're interested in. The first question I ask a student who comes to AOGME to do research with us is, have you done a literature review on your research question? And if they haven't, and the question is already answered, it's going to be very difficult to get that paper published unless you have a new population of interest, unless you have a new slant on it, unless you have a new methodology for it. It should be grounded in theory and in existing evidence. If you don't know what theory means, I suggest you go to the Papers podcast and look up Lara Varpio's theory consults if you're a podcast person, or Google something similar, and see what kind of theory you want to use for your paper. Should be ethical and appropriate, and Tony certainly touched on this when she was talking about the use of AI, but in terms of evidence and the use of data, we want to make sure that we have permissions, appropriate permissions for the data, and we have appropriate protection. So we've gone through an IRB review, even if we believe that it is not that it is appropriate to use the data without IRB review. If it involves humans, I always do an IRB review. So even if the IRB finds it exempt, good job. Then at least I know I've met that ethical criteria. And then it's not just a yes or no question, it's open to an investigation. There's lots of things that you can learn about the question. So as my little mnemonic that I use when I'm looking at my own research questions or when I'm talking to others about their research questions, FINER, is it feasible, interesting, novel, ethical, and relevant, right? So quality improvement research is research that tries to improve patient outcomes or system efficiencies, identify process bottlenecks. And one of the big methodologies for doing quality improvement research is a plan, do, study, act cycle. So you measure something, you plan to improve it, you do the improvement, you measure it again, and then you follow up. Did it work? Did it not work? Do we need to change it? And students are quite capable of both understanding and implementing PDSA cycles. Quality improvement has a lot of resources for you. You're going to get these slides, so you don't have to write these down or anything. But if you look at that last resource, that is from the authors, or from the editors, I should say, of the Journal of Graduate Medical Education, instructing residents how to write up their quality improvement initiative. It's very clear. It's very step-by-step. It has the sections of the paper in it. I encourage you to use these resources when you are working on quality improvement research yourself. I always use the first one and the last one, and that's only because I'm already started in QI research. But I encourage you to use these resources for your own QI research. They are a great step-by-step guide. Once again, that data is already gathered. It's in the electronic health record. You have to figure out with your facility or with your institution how to get it out. Workforce research addressing shortages, either of physicians in general or of primary care physicians or a specific specialty. What's the impact of workforce diversity on outcomes? Geographic distribution of specialists or primary care physicians. This is a look at ophthalmologists, MD versus DO in rural areas. What they found was that numerically, not even as a proportion of all physicians, DO ophthalmologists outnumber MD ophthalmologists in rural counties in Michigan. All right, so that's a paper that you can use as a guide. Where I don't have an instruction sheet, I try and give you a paper that provides instructions. The data in this paper came from a state licensing board. You can often use your state osteopathic medical association or state medical association to help you get that data from the licensing board. I used to run the Arizona licensing board, and I know it was certainly possible to get data from the Arizona licensing board. Medical education research as delivery models like problem-based learning or team-based learning to look at educational outcomes or assessment outcomes. Educational trends like AI right now, the outcomes of competency-based or other educational models, the impact of interprofessional training. These are all examples of medical education research, the integration of AI into courses, augmented reality and simulation. So for competency-based education, systematic review of available competency sets for use with MD and DO medical students. How many specialties have published competency sets for undergraduate medical students, for students in MD or DO schools. That would be a great study. I need it. I haven't done it. I would use it all the time. Using AI to map the delivery of interprofessional education objectives. Can you use AI to map your curriculum? Writing down a guide of something that you did using AI to map your curriculum would be very helpful, as you know, to other educators. Literature reviews. The three biggest types are systematic, scoping, and narrative reviews. A systematic review, I think most of you know, is a way of reviewing what is in the literature. A scoping review focuses on the gaps, and a narrative review focuses on the connections or sort of the story that the literature tells. Identifying gaps and synthesizing findings, and especially the reason to do a review is to build a foundation for future research. There was just a scoping review on osteopathic medical education published, I think in January maybe, in the Journal of Osteopathic Medicine. It has some great recommendations for future research in medical education, which is the thing we're talking about today. A systematic review of the impacts of pass-fail grading. Did it really improve student well-being, right? There's a lot of individual studies out there. Someone could aggregate those studies and make a determination. So just as sort of a reminder, good research questions lead to good research. And so having a lack of focus or a bad research question is really going to delay the publication of your research, because it'll be tough to complete the research and it'll be tough to find reviewers who like the research. Misalignment with journal scope, Tony talked a lot about this, and inadequate methodology or data analysis. I know that you're not a most of you are not statisticians. These methods that these article types that I've described don't require a lot of data analysis, but they do require some data analysis. So make sure that you have a resource, even if it's just calling us at AOGME, to do that data analysis the right way. Tony had this near the bottom. I would put it right at the top. The first thing you should do is read the journal's guideline on the use of AI. Before you start down a path of using AI, I use AI in my research all the time. I am terrible at writing headline titles for my papers. I'm horrible at it. It's going to look like the third sentence of the results section if I write it, right? AI writes great, catchy titles that, have colons and other punctuation in them. It's awesome. It can help you generate research ideas and outlines of research. It can help you summarize articles and identify trends among articles. And it can be your own personal reviewer too. Reviewer two is sort of an inside joke. That's the hard reviewer, the one that nitpicks all the aspects of your paper and tells you how terrible it is and you should never submit another paper anywhere again. And AI can be your reviewer too, and really give you a good idea of how you might improve your paper before submitting it. But again, always read the journal's guidelines so you know what uses of AI are permitted by that journal. So again, identify research gaps, develop finer questions, use good models. So find a paper that's a good model for you, ensure the journal fit and follow its guidelines. And if you're permitted to do so, use AI tools to strengthen your work. So we've already gone over these final thoughts, but I really want to thank you for the research work that you've done, but especially for those of you who are mentoring future researchers. Thank you, thank you, thank you. I'm going to turn it over to Gav now.
Thanks, Mark. So I have the pleasure of being, the distinction of being the most procrastinating of the co-presenters today. And so I got an opportunity to see some of the notes or the slides of the other presenters. So I try to not repeat much of the same material, but I definitely failed at that. But we'll see that in a minute. My name is Gav. I'm the director of data science. And full disclosure, I am new to medical education. My background is primarily in population health, public health, and epidemiology. So you'll see a little bit of a slant there, but I think a lot of the principles still sort of cover over. So I want to supplement some of what Tony and Mark discussed. And so it's going to be a little bit of hodgepodge. I'm going to jump around a bunch of places, but I'm going to start with Mark's foundation of a good research paper, but I'm going to go a little bit into the data and method side of it. And then as we round that out, I'm going to jump into an area that Tony covered pretty thoroughly about the peer review process, but I want to talk a little bit about my experience, particularly in the responding to reviewer comments and that experience of what I was anticipating, and then sort of over time as I worked with students, and I work with students pretty much every year, and sort of guiding them through that process, what I've sort of learned works. And then ultimately some more general advice, more general and specific, just sort of a hodgepodge of advice that I would give based on my experiences. Okay, so I want to start with whether you're doing quantitative or qualitative work, you need data. Mark talked about sticking to secondary data that has already been produced and created so that you can skip that data collection step and complication. Most of my work has been in this area, but if you do have the privilege, the infrastructure, and the resources to do primary data collection, that is collection of data based on surveys you've designed, or maybe you've built out an experiment, I want to talk about those too. And then regardless of which type of data you have, what kind of curation mechanism you have for your data for your study, there are ethical considerations throughout the entire process that are going to impact various stages. Mark mentioned IRB approval. One thing I talk to students, there are clear guidelines of what would and wouldn't require IRB approval. But if you're in doubt, submit to the IRB, as Mark said. Let the IRB tell you it's not appropriate or not necessary and why, or give you an exemption or a limited, or however they decide to handle it. It's important for you to have that oversight. The responsibility of the IRB is to make sure ethical research is being done and to both protect the subjects of your research as well as you, and improve the entire process. I spent a whole lot of time in, like I said, population health and epidemiology, and HIPAA was a big part of my life. FERPA is now a big part of my life. Maybe you have a cross-section with both legal frameworks are part of your life. HIPAA governs patient medical information, and FERPA covers the same sort of PII and sensitive information for students. They're a legal framework, so it's very possible if your research is touching any of these areas that you're subject to these legal frameworks. It's a good idea to get training and understand the rules and regulations associated with that. And even beyond whatever legal framework that you have to operate under, privacy and security are critical throughout the entirety of the process. A good consent form can open up your subject to feel more comfortable in responding to your survey, or extending the period of time in which a subject might be in a clinical trial. Security of the data during the analysis all the way out, and privacy on publication, making sure that it's not possible to re-engineer and get backwards and identify a person or an institution that you've published about, while still trying to maintain reproducibility. Now, I want to get to the bedrock of, I spent 80% of my time, and yes, I'm biased, I spent 80% of my time in methodological exploration. And I do it primarily so Mark doesn't have to spend 80% of his time in methodological exploration. If you're in primary data collection, what I'm talking about here is the design of experiments. If you have found your data, this is secondary data. What I'm talking about is exploratory data analysis. But ultimately, you and I and most researchers want to say something about reality. We want to do our analysis, our work, and bring it back to the real world, and hopefully impact that real world. But unfortunately, our methods and our models don't act on reality. They're done on data. And data is an abstraction of that reality. And as a byproduct, it has a degree of compression and a degree of distortion that really needs to be considered. So if you have survey, maybe there's response biases, and you can look up, there's a whole set of response biases. There might be sampling problems. You might not have a sample that's representative of your population. You might have missing data. You might be working with machines that have certain issues with them that might distort results. You might be using something like government data for a purpose that it's not intended for, or worse, something I did for years, which is use claims data, which is meant for paying medical interaction services and using that to talk about the medical interaction itself. All of these possess some form of distortion. And when we go to model that data, we're really modeling that data generation process. So to bring it back to reality, we have to be mindful of what potential distortions exist. So being mindful of how big of a sample, what your response rate is, what potential biases might exist in how people approach responding to you or sticking in with your study, or why did BLS produce this data, Bureau of Label Statistics produce this data? What level of resolution does it have? Are you really interested in something that is really at the census tract level, or are you talking about the county level? And what level is your data at? All of these questions are really, to me, and again, it's the whole field of statistics is about this. And I'm not asking you to be a statistician, but I think if you have a firm understanding of how your data is an abstraction of your reality, once you come to model it and you have your results, you can better link that right back to the reality that you really want to talk about. And that's what, to me, is the bedrock of a really good paper, is does your data and your modeling really bring back to that question that you formulated with Dr. Spiker? I think this ends up being sometimes an iterative process, because that distortion, that model technique, all of those things sort of define what kind of questions you can ask and how you can answer them, and what kind of assumptions and conceits you have to make that have to all be sort of expressed all the way from introduction, methods, results to discussion. That's my pitch for getting a biostatistician and AI not replacing it, Mark. Okay, so I want to move on to the peer review process. Tony did an incredible job covering this, so I don't want to redo and sully a lot of her what she's talked about. Instead, I want to talk about a little bit more about the okay, you've submitted the paper. You did a great job of reading the rules about the journal. You did your style guide. You read all the requirements. You submitted correctly. You did a good job fitting with the journal. You didn't get a desk rejection. Now the peer reviewers came in, right? They have a better understanding of your subject area. They have a better ability to assess that originality and that relevance and really go at your methods and determine the rigor of your work. And they've provided you a bunch of responses. As Tony said, you might get pages of them, and it might be very overwhelming. My suggestion is take a step back, take a deep breath. Realize the whole purpose of this process is to hone your work to make it better. The journal wants really good work. You want to make good work. Sometimes it feels like the peer reviewers are, and you are sort of on opposite sides of this field, and you're going to go to battle. But in reality, you're all on the same side. More practically, I recommend you take all of those responses, put them all in one sheet, a shared document, triage them. Some responses are very minor. Some are major. Some are actually critical. They might have significant impact. So just combine them all into one document, a shared document across all your co-authors, tag them, triage them, and then assign them out to the members of your team who are best equipped to answer that. For example, if you're working with me, most of the methodological questions would be addressed to me. And probably there's going to be a lot of methodological questions if I've worked on your paper. And so you have one central location where everyone could coordinate to address every piece of feedback, work together on some feedback that needs to be coordinated, and make sure everything's sort of out in the open and done as a team. Now, when my first publication, I worked with a mentee, somebody who actually sat on Dr. Spiker's committee, and it was my first paper. They threw me a couple feedbacks to address. I was very young. I was still an undergraduate. And I remember writing like 2 essays essentially for the 2 responses that I had. For the first time you come to this, you may think you need to respond with quite a bit of information back to these reviewers. But in reality, most responses they're very, very, very brief. More often than not, it's just a acknowledgement and an addressing of the issue in the paper. So clarification of some decisions you've made, some clarity in the writing, some additional limitations that you might express. Most of the time, there's sometimes you have to bring stuff that you sort of left on the cutting room floor. Maybe some information about those distortions that I talked about earlier that you sort of already considered, picked your model and move forward. But now the pre-reviewers want to know, well, why did you pick this model? And you have to come back and get some stuff that you probably already have and put it back into the paper. Now, there are instances in which you do have to push back, and you have to get comfortable with those instances. Tony mentioned there are times where people just misunderstand your work, misunderstand your methods, misunderstand your interpretation. It's a good idea, again, to take a step back, drop defensiveness, and try to understand why they're misunderstanding you and address that. There are other times where the author, the reviewer rather, is asking you to do something that's genuinely out of scope. It might be an adjustment to your methodological process that's just not possible. Maybe they have an issue with the way you collected a piece of information or scored something. Sometimes that's doable, but it would dramatically change everything. You'd have to rerun results and you sort of have a different paper. You have to, in those situations, sort of be respectful, acknowledge why that might be an issue, and just state that that's not something that you could do. Other times, the extent of the feedback sometimes pushes the focus away from your intended focus and muddies the clarity of your paper. It sort of introduces scope creep after the fact. And that's also another situation where you're welcome to push back. And of course, people can give bad or wrong suggestions. My first peer review experience as a peer reviewer was directly after that first publication. I had one publication under my belt, and that journal reached back out to me in 4 months to review a paper. I'm sure I gave bad advice in that situation, and those people were well justified to push back. So get comfortable. You know your paper better than anybody else. You might not be the foremost expert in the space, but you know what you did. And so feel grounded in that. And then if you do happen to get rejected, that's okay. It happens to everybody. Just make sure you know why. Get all that feedback. Maybe it was a bad fit for the paper. Maybe there was something wrong with your methods, your results, your interpretation, your writing. Maybe there was a clarity or language component to it. All that information is going to be helpful to you as you continue to hone this work that you've done, make it better, and continue moving forward. All right. So a couple just hodgepodge practical advice I have. Journal selection. Tony covered this pretty well, and so did Mark. But I will mention, I fortunately have not had a career that has essentially incentivized publication, impact scores. I know nothing. My work can be exposed to the right audience. It is always something that we're constantly working towards. Fortunately, if you're new to the space, there are tools for that, like Jane. I think Tony mentioned that. There's also Journal Finder and Journal Suggester, all work very similarly to sort of match you up with the journals that you might consider. But nothing beats looking at recent articles in that paper. Essentially, go to that journal. Go to that journal and look up papers of similar content as yours, either methodologically or otherwise, or subject matter, and just sort of read through them. You get a good understanding. It's important to align not only subject matter but methods in a paper. If a journal sort of expects a certain type of approach and you're using a vastly different one, you have a mismatch even if your subject matter is the same. You might consider adjusting, you might consider going to a different journal. And then lastly, something I've had a lot more exposure to recently is theme journals and conferences. Sometimes journals will put out a special edition that really hones the audience for your work and is a really exciting opportunity to get some really special work out there. And they come sporadically, so definitely look for them. And then the other one is conferences, which allow you to sort of showcase and maybe make small iterative changes to the work you've done or are doing. And then you obviously get to travel and meet new people and interact with people that are doing work like yourselves, which is an incredible opportunity. Both Tony and Mark shared guide papers with you today. Guide papers are critical. They can be a lot of things for you, but they essentially act as exemplary papers, either in structure, methodology, or subject that can really help guide your writing. You're obviously not copying these papers, but guide papers exist to help you understand reporting guidelines for certain types of data or study types. There are also other guide papers that will help you understand how to write a good paper in an area, but then there are also guide papers that are just exemplary. I have a paper I often go back to. It's a criminal justice recidivism paper, but it actually did an incredible job comparing different models. And because of the subject matter and how those authors not only reported model performance, but really brought that back to the subject matter, I think they did such a tactful job with that, that I consider it an excellent paper that I look to when I do similar work to make sure that all my work is always doesn't get all statistician-y, and it gets grounded in the reality of the area that I'm interested in talking about. Couple last notes is I'm a terrible writer. AI has been great for me, and it took me a long time to learn how to write. So I highly recommend you sign up for that the webinar that Tony advertised earlier about writing. It was through my graduate program that I finally learned how to actually write. And it was a very painful process because I'm one of those people whose instinct is to edit while writing. And that's just not a good strategy for writing. You just have to write, and then editing is a completely different process that comes secondary to the writing process, to the writing step. And then in addition to that, you have a variety of collaboration tools now that make collaborative writing much easier than it has been in the past, whether it's reference management, code management, or writing. There's tons of tools there. So use those in addition to the newer tools. Obviously, AI is really helpful in doing all kinds of things. But each group has its own culture. So especially as a young researcher, you're going to move from group to group to group. So learn those best practices, learn what's working and what's not working in each of the groups you are in. That's tool, workflow, culture, how they're handling, how are they assigning distinctly parts to each author, or are they going through rounds? How are certain things handled? Just be open, eyes open, be aware, sort of observe and understand where things are working well and when things aren't working well, and essentially take those with you as you move into the next group and next group. All right, so I'm trying to wrap up because I think we're out of time. So closing thoughts: publishing is a process. It is iterative. You have to be comfortable with that iterative nature. Think critically about your data and methodology. I know I come from that specific bias, but I urge you, I think that ends up being the bedrock. I've seen a lot of papers where I'm looking at that methodology and going, they can't actually answer the question they've posed. That just doesn't work. Good research is a team effort. Learn from those around you, including your reviewers, and don't be intimidated by this process. It's meant to be hard. It's meant to put a high bar, and it's meant to improve you through that process and stay persistent. You can ask Mark about all of his history of rejections. It's pretty long. Thank you very much.
Thank you so much. This was a great presentation. I took home a couple of nuggets that I wanted to share with folks. I know we had so many questions and a lot of them were already answered. And some of the nuggets that I got was, don't be afraid to use AI in your scholarly work. Use AI, use it as a thought generator, an editor, a designer of a catchy title. I thought that was great. I love the idea of listening to podcasts to help your juices get flowing, creative juices get flowing. I love the checklist, the finer checklist. And also the nuggets about, that was mentioned several times, don't get taken aback by the feedback. It's meant to be a process. Feedback, I mean, in medical education, we talk about feedback constantly. Feedback can be hard and scary, but it's part of the process. We take that feedback and take that deep breath and just kind of plow through item by item and not take it personally. So I think this presentation had so many nuggets. It's going to be posted within the next week. And I encourage folks to listen to it again. There were some great tidbits in here. So please, if you have any questions, contact us directly at aogme@acom.org. And this concludes our webinar for tonight. Thanks so much and enjoy your evening, everyone.